Welcome to Physician Heal Thyself, the podcast, empowering you to take a whole person approach to your well-being, spirit, soul, and body. Join me, your host, Dr. Lara, naturopathic doctor, entrepreneur, and a servant of Jesus Christ. We are not just a body, we are spirit and soul. It's time to integrate medicine and spirituality into our healing. Let's get started. Welcome to this episode of Physician Heal Thyself, the podcast. I'm your host, Dr. Lara. Today, I want to talk about something. We want to get to the heart of the matter of things, right? Not just for patients, but also for those that work in the healthcare industry, whether they're doctors or nurses or any role in the healthcare industry. Today, I want to discuss something that it's becoming very difficult for me to ignore. And I'll tell you that, social media, their algorithms are very interesting. And we all know that somehow, some way, our phones are listening to us. But what sometimes things get very kind of eerie and a little creepy when there's something that you are feeling, you're experiencing, but you haven't really talked about it to anyone. You didn't search online for it. And so it's just something that maybe you're thinking or something you're feeling that you're processing that has not left you. And when these algorithms, whether it's YouTube or any of the social media platforms, start to show you certain stories, reels, or on YouTube, right? They start to show you on their algorithm what things you might be interested in. It's very, very fascinating to me how things come up that I haven't searched, I haven't talked about, but they're presenting there. So recently I noticed, and it's probably started to happen since sometime in May and in June, I started to see this reoccurring trend on my YouTube account where it was suggesting certain videos, and I had been feeling some sort of way. And I'm going to tell you why, because my podcast is meant to be very conversational, very real, and very personal as well. So I have been experiencing some tragic loss. It all kind of happened back to back, 3 things all in the same week, right? They all say that things come in threes. Well, it did for me. Several things. And then the third thing that happened in that week that was very tragic, I had a dear friend of mine from high school that was killed by a city bus. She was crossing the street and she was hit by the city bus and died instantly. I didn't expect, no one ever expects, but I did not expect for that hardship to hit me that hard, to take me out energy-wise, mentally. And I went through all the stages of grief, like in one day, right? And in that week. And I found myself having to apply what I always teach, which is to take care of myself, right? Physician, heal thyself. I needed to slow down. So immediately I knew that next day after I heard this news, I could not see all the patients that were on my schedule for that day. I just knew I couldn't mentally and emotionally and spiritually handle all of that. And so I took care of me. I rescheduled some of those individuals, moved things around to make it more, just easier to get through. But unfortunately, that kind of carried throughout the rest of the following month or so. And throughout this time, I had a struggle of trying to get back on board. It was hard for me to move past that because I had a lot of questions. And so that's when I started to notice that on my YouTube, I was seeing these videos, and they were all titled, My Reason Why I Quit Medicine, Why Doctors Are Quitting Medicine. And I kid you not, I am seeing these videos all the time. And I started to stop. I stopped and I kind of paused and thought, am I feeling that way? Do I feel like I want to quit medicine? Why is this algorithm suggesting these videos to me? I haven't said anything. I haven't searched anything. So why am I now constantly seeing this? And of course, If you click on one, then you're going to start to receive more of the same content. So it piqued my curiosity. I started listening to these medical doctors that were making these videos on their channels talking about the reason why they decided to leave medicine. And so this episode I want to dedicate to talking about this crisis of what I consider it's a crisis of seeing physicians leaving medicine altogether, maybe changing directions, and also what does that mean to you as the patients? Because I'll tell you this, that physicians, they spend a lot of time, a lot of money, and they sacrifice a lot to go through this career. I would say that the majority of people that go into medicine, they go into it with the right heart posture, with the right intention, and that's to help people to heal. Bottom line, we want to help people to heal. So physicians are spending 10 to 15 years in training or more. If they're surgeons, they're going to be spending maybe more time than that. They are spending hundreds and thousands of dollars, anywhere from $250,000 to $500,000 in their education. They're sacrificing a lot of sleep. They sacrifice relationships, finance, and oftentimes their own health and well-being. And so why would a physician who's gone through all of that sacrifice, all of that dedication and commitment, want to eventually say, I can't do this anymore. I don't want to do this anymore. I quit. They could have quit anywhere at the beginning of their journey, but why after 5-10 years of practicing medicine? And that's kind of the trend that I saw. So it's beyond being burned out. It's a systemic problem that's causing this issue, that if doctors don't feel like there's a way out, that there's not a way to improve, then they're going to end up quitting. So I want to talk about these numbers. I looked up some numbers to see what are we looking at here. This is not going to be 100% accurate because not every doctor is part of these surveys, but it gives us an idea. And so while physicians, since COVID, a lot of physicians and nurses and other medical practitioners have been burned out because of the demands that happened during 2020 and 2021 and on. But the recent national data from the American Medical Association found that 41.9% of physicians have reported one, most likely more, symptom of burnout in 2025, which is down from 48.2% from 2023. So that means soon after COVID, more people were reporting these symptoms of being burnt out. In the Physicians Foundations of 2025 National Survey, they show a picture of 54% of physicians report frequent feelings of burnout, 55% report debilitating stress, 57% experience significant depression, anxiety, anger, emotional distress during the past year. This is for 2025. And nearly half report withdrawing from family, friends, or even coworkers. And more than 1/3 report feelings of hopelessness or lack of purpose. And so this isn't just about doctors. Like I said, this is about patients. Will patients have access to quality health care in the future when we already have a shortage of doctors? This will create an even larger gap of patient to doctor ratios. And so let's get started. Let's talk about why are some of the reasons that doctors are leaving. And this is really geared a lot towards conventional medical doctors, your doctors in the hospitals, in the ER rooms, doctors who are working for big, large practices. Many physicians have entered medicine, right, because they want to help people heal, bottom line. And instead, many are feeling like they're working inside a corporation that's focused on productivity metrics. And so these metrics involve, the rate of return of this large hospital or clinic, productivity, billing, patient volume, the quality metrics that each doctor is expected to make sure that they're doing throughout their work. So they're an employee, and any of the financial performances are also, the responsibilities on the doctor. It's almost like a salesperson. Are you selling these things? Are you promoting these medications? And doctors don't want to do that. Doctors oftentimes, describe feeling like they're more of an employee than they are a professional, and they are. Many report losing autonomy over things like the appointment length time, clinical decision making that should be between the patient and the doctor, scheduling issues, staffing, and even how they communicate with their patients, what they can and cannot communicate with their patients. And so this takes out that traditional doctor that over 100 years ago, originally doctors were part of the community. Everyone knew the doctor, and before there were clinics, oftentimes doctors were making house calls, going into people's homes and helping them there. Or maybe they were opening their home and patients were coming to their home for the doctor to help people in the community. And that old, school doctor feeling is gone. Everything is business. Everything is measured by metrics and performances. And that makes a physician frustrated, because I look at medicine, though it is a science, there's also an art form to medicine. And the art form, when it comes into play, we're talking about the humanistic side of us. It's the relationships and the communication and caring for that patient. That's part of the medicine. That's part of the treatment plan. Obviously not in conventional medicine, but that was the original roots of, family medicine. So as you can imagine, many physicians are frustrated that they are working a lot. They've lost control over how they can practice medicine for themselves with their patients. There is a huge administrative overload that doctors are having to face with. So one of the greatest contributing factors that some of these doctors were discussing on these platforms were the endless amount of paperwork. And it's great that there's a convenience factor of electronic health records. It was designed to improve, continuing care and tracking information. But what we find is that doctors are spending many hours now completing these documenting things in the medical chart. And if they don't finish it during that patient visit, which rarely happens, I'll tell you, they have to finish it after clinic, which means that oftentimes doctors may be taking work home, which they shouldn't. Prior authorizations, insurance, coding, compliance, all the documentation needed are all things that doctors have to do, but they don't enjoy doing this administrative part. It's important, but it's over consuming the physician now to doing that. So this is part of the reason why doctors are allotted 10 or 15 minutes to be with the patient, but oftentimes they don't spend that time with the patient, because part of that 15-minute allotment is there prescriptions that need to be filled? Is there lab orders that need to be issued? The doctor's taking into account, wrapping up that chart note. And so it leaves very little time for the doctor to spend time with that patient. Oftentimes it's a 5-minute visit. Now, if that doctor is spending more than that time, thank them, because chances are they're going to spend an extra 15, 20 minutes after your 15-minute appointment so they can finish up their documentation and their charting. Now, there's all this AI technology where now there's AI systems that are recording and transcribing the conversation between the doctor and the physician, and for the most part can, document all of the charting. But there's a couple concerns I have with that. One of them being, what if there's things that the patient shares that maybe should not be documented? It's not really necessary to put there. The doctor's still having to go in there and modify and edit these things out of the chart. No, they still have to go in there and put, all the CPT codes and enter their exams and assessments in there. So either way, it's still work that needs to be done. So The other thing that a lot of these doctors, especially surgeons, I saw a lot that, believe it or not, there are surgeons that are stepping away from practicing surgery altogether. And so oftentimes the insurance companies are just creating more hassle for the doctors to do their work by getting prior authorizations. And sometimes they get the prior authorization to be approved only to then be, turned around and denied for whatever reason. And so there's all this back and forth. Then it makes the doctor seem bad in front and the staff in front of the, in the eyes of the patient, because they seem like they're not getting it together. But what the patient doesn't understand is all the back office communication and back and forth with the insurance company to get those prior authorizations. There's also something called step therapy, or it's defining that there's a step-by-step process of where you start with therapy or even imaging. A doctor knows when they need to do an MRI. I mean, if they know that this certain condition requires an MRI, not an X-ray, they know the X-ray is not going to show the information they need. The insurance company, guess what? They want you to start with the X-ray. And so, and sometimes there's nothing there, so the doctor still has to do the MRI. So now they just made an unnecessary expense with the X-ray imaging, and so the same applies to medications. Or certain medications that insurance companies want you to follow those therapies in a certain order before. You can't just jump to the medication you think you should be, the patient should be on. The insurance companies want to dictate which medications. And I know this is true because even though I don't work directly with insurance, my patients have insurance. And if I prescribe a medication, say I prescribe metformin, well, that insurance company may also recommend, most of the time they want the physician to also prescribe a statin drug. Not because the person has high cholesterol, because they don't even know their labs. The insurance company doesn't know their lab results, but they're going to say, because you prescribe metformin, the guidelines are that you also prescribe a statin drug to what? To protect the kidneys. Well, as a naturopathic doctor, I can tell you that there's many other things that I could do to protect their kidneys. Mainly, the first one is, let's put this diabetes in control and remission so that your blood sugars are stabilized, and it's not going to have an impact on the kidneys. But no, they're consistently very persistent that you prescribe that statin drug. Now, for me, because I'm not working under the insurance, I can deny that. And I don't write the statin drug, and I just tell my patient what to do. But if I was working under the insurance company, they would flag me. And what that could mean is that when it comes to renewing my contract to be contracted with the insurance company, if I'm not following what they tell me to follow and do, then I would be kicked out of being under that program and not be able to accept patients with that insurance. So there's a lot of control there. So a lot of, documentation with insurance that doctors have to do. And I almost feel like doctors at this point have to become like attorneys to present the case to the insurance company, all the evidence and all the support to then get the approvals, get the okay to then move forward with sometimes with a surgery that is, it's life-threatening. It needs to happen now. It's urgent. And so these are some of the things that can contribute to what I call this moral injury. Doctors are tired of having to deal with this all the time. They're not dealing with just a couple cases of these things here and there. It's every day, throughout the day. They're having to deal with a lot of this. So, the doctors have lost. There is a loss of this doctor-patient relationship that I kept hearing from these physicians in these interviews as they're talking about why they're leaving medicine. There is actually, believe it or not, a need and desire for doctors to have this connection with their patients. They want to get to know their patients. They want to have those conversations to be able to educate their patients. It's just there's not enough time. If they're allotted 10 minutes or 12 minutes or 15 minutes, it's not enough time. And so they're reviewing medications, updating documentation during that time. they're trying to satisfy their employee quality metrics, and they're answering messages, completing billing. And like I said, this does not build this therapeutic relationship with the patient. And so they're more worried about what's going on the computer than what's going on here. And it's not intentional sometimes. I think the longer the doctor is in the system, they just kind of become numb and detached, and they're just part of the process. Oftentimes, a lot of what I heard in these interviews from doctors that are leaving medicine is the long hours. There's this culture that's been created around physicians that, you just have to work hard. You just have to sacrifice, and working these long shifts, does not allow them to have the energy, physical or mental, to do other things outside of that. And so I've had the pleasure of helping a couple of physicians, and some of them were in the hospital, some of them were big clinics, and I do my full panel of hormones and everything, and I'll ask them, how long have you been feeling this way that you're reporting? And they'll say, oh, for a long time. And so I'm like, okay, how far back? Many of them have said, since I finished medical school. And most often it's right when I was in residency. Residency really overwhelms them. There's a lot of work, long hours, and they're working many days. And so this tends to really start the process of that burnout for them. And, can you imagine you've worked so hard up to that point, and then you get into practice to then say, I'm too tired mentally to want to continue. So oftentimes the mental health, and what I say, this moral injury, it's where that burnout takes place. They cannot handle the stress. They still want to do the work, but they just cannot handle. And they get to the point where they make a very difficult decision. They've been thinking about it on, and they feel guilty for having to go through all that and then quit. But what I want to share with you that I found very interesting, I started to also see the pattern of these videos, right, of these doctors. And I saw I noticed that a lot of them looked younger. Now, some people can be, older and just look young, but they all seem to be under the age of 40. So maybe in their 30s. On average, they look like they were in their 30s. And I started to question and think, could this be a generational shift as well? And I remember back in 2007, 2008, I was in my MBA program, and believe it or not, we were talking about the future, the trends that we were going to be facing in the future. And one of those was looking at the generations, the younger generations, the differences in their mindset about work ethic and work in general, lifestyle, and so forth. And please do not misconstrue my words. I am not trying to make younger generations look bad. I actually want to elevate them and give them credit for they're not willing to accept the shit that everyone else has. And that's the reality. And what we see here is this trend that I notice of younger physicians leaving earlier in quitting medicine, because these people have not been practicing 20, 30 years and then retiring from medicine. They finish residency, they're in practice 5 to 10 years on average, and then they're like, I'm done, I don't want to do this anymore. So it's not that they're lazy, it's not that they don't have the work ethic. Because let me tell you, if you've gone through a medical school program and residency, you could not have made it through either of those if you're a lazy person. And so we know that these doctors are very committed. They worked really hard. Some of them got into really good medical schools, Ivy League medical schools, and really good very high demand residencies. Some of them are surgeons, and some of them are in specialties. And so they wanted to do this, and then they're just so burnt out and tired. And I'm going to tell you what I noticed between these younger physicians and older physicians is that it's the healthcare system that younger physicians are entering right now, it's not the same medical system that older physicians were entering. If you compare physicians who've entered medicine in 1985, it is not the same system as right now in 2026. So it's not fair to say that maybe these younger doctors can't handle it. No, they're not willing to compromise their values and their lives. They're not willing to do that. So let me just give you a comparison here, because the older physicians who were trained, they were trained under a culture that emphasized medicine is a calling, personal sacrifice is expected of you, long hours are part of the profession, and your patients come before your personal life. And let me tell you, even as a naturopathic doctor, as I was going through medical school, I had a couple of doctors share this sentiment. They were older. They had been in the healthcare industry, the conventional healthcare industry, and they had this mindset of your patient's health and well-being comes before yours. And I disagree with that. This episode, which is named Physician Heal Thyself, it's making the physician a priority for a reason. Because if you're in the health field you're in this field to help people heal, you cannot help someone else if you're not implementing those same concepts into your life. You cannot, give out of an empty cup. And so you need to apply all these principles into our life. There has to be a balance. I know everyone talks about work-life balance, and some believe there's no such thing. I do think there's a such thing. I think that the body has the same system in place. It has a homeostasis way, right, to keep things in balance, nothing too high, nothing too low. And I think we should strive for that in our life, make it a priority to have a work-life balance. So many of these younger physicians, millennials and Gen Z, they still view medicine as meaningful work, right? They still see it as a calling. But here's where they're more likely to have these belief systems. They want boundaries. They want boundaries for the companies they work with, boundaries with personal time off and work time. They want to be present for their families. Do you know that oftentimes, especially female physicians, they're postponing having children to a much older age. So they're sacrificing getting married, having children. And so when they do have children, it's to no surprise that it is female doctors that have reported to leave medicine at a higher rate compared to men. Although I will say that a lot of the videos of these interviews that I saw on YouTube, it was coming from male physicians that were leaving the field. So people want to be present for their family. Even fathers want to be present for their kids. They don't want to pull 14-hour shifts, go home, be exhausted, sleep, and repeat this ongoing all the time. They also believe that their identity is more than their profession, which I applaud them, and I agree. I talk a lot about identity in this on the podcast, and the importance of knowing your identity in Christ. And I think it's important that more doctors and more professionals realize that your profession is not who you are; it's what you do. I love what I do. My lifestyle mirrors a lot of what naturopathic medicine is, but at the end of the day, I'm more than my profession. And so they want to have a life, right? They also are prioritizing their own mental and physical health. They want to prioritize sleep, they want to be able to exercise, they want to be able to enjoy life as well. And so, and they don't feel, younger doctors feel they should not have to sacrifice their entire life to be a good doctor. And I applaud them for that, because I agree. I think that a good doctor is a doctor that implements all those nature's laws and laws of health, for all those wonderful concepts of what good health is. They're going to implement that. And so balancing our work-life schedule is important. So, there's a lot of these younger doctors that they're sharing their stories and how much stress is behind their work, especially if they're working in a hospital. Doctors who work in a hospital, they're going to see a lot of trauma. They're going to see, unfortunately, they're going to have people pass away. And they're expected to move on to the next patient like you just didn't see someone die. You didn't just, try to resuscitate a baby and didn't make it, and so they die. How do you move on to the next patient like that didn't happen? So what are we doing for healthcare professionals? Because this also impacts nurses and people who work in hospitals. What are we doing for their mental well-being? What's in place for them? They're not machines. And so sometimes this is why doctors can come across very cold. It's not that they're cold, it's they're being resilient to be able to get through their shift. But I'll tell you that many of these doctors, especially on these interviews I saw, many of them are reporting having to go home, and their families already know. They're going home and they're just crying, and their families know not to ask, because chances are they probably experienced someone dying that day or several people dying that day. And so, these new doctors are coming into a whole different system. There's a lot more sick people now than before. Insurance is a big issue. The what's expected from a hospital or a large clinic, employment-wise, is very different. Now in current days than it was 40 years ago. And 40 years ago, 30 years ago, even 20 years ago, more physicians they had their own private practice. And I don't know if you're paying attention, but I am. In my area, I see more and more private practices. That means that it is owned by a physician or a group of physicians. They're closing their doors. And they're moving on to be employed with these bigger clinics that are owned by hospitals, by the way, in case you didn't know. And it's sad because it loses that autonomy. See, I have my own clinic. And though there's things about administrative wise that I don't like to do, I do have that personal autonomy and decision making in my business, in my clinic. And these doctors don't. So this is where they feel stuck. They feel overwhelmed. Just like I started this episode, when my friend's tragic passing, I had the autonomy to decide that next day, I can't see this many people that day. I won't be able to get through the day. I just knew I couldn't. I had the power and control to make that decision. I didn't have to ask my employer for permission. And so I think it's important that doctors, I know not every doctor is meant to own their own clinic. They don't go to business school, right? They go to medical school. But some doctors have it in them to do that and open up other opportunities for other doctors to come work in these smaller clinics that, give more control to the physicians of what to do. We're still going to need doctors in hospitals. But what happens when we don't have enough doctors that are staying in the hospitals to work? So if we complain about waiting 5, 6, 7, 8 hours in the emergency room, how much longer will people be waiting in the future if there's not enough medical staff to help the demand, right? So that's my concern. I wish I could have this conversation with these young physicians of, no, don't quit. Maybe take some time off, a year, 2 year, whatever it is, but go and start your own practice or go join a different practice. The same thing with surgeons. A lot of these surgeons are working, they're contracted with these big hospital, networks, and instead of having their own practice as a surgeon and still have hospital rights to do surgery, use surgery centers. Some you could do in surgery centers. Some surgeries have to happen in a hospital, but these doctors can still have hospital rights to that. Might be a better option all over the place. So this is a concern. If we are seeing conventional doctors that are leaving medicine, and I'll tell you right now, as in the naturopathic medical community, we're facing our own challenges from a federal standpoint. And this might be another conversation to have another time, but it's impacting our accrediting bodies. It's impacting the schools. And so where naturopathic doctors have been able to help fill the gap, right, of where medicine might be lacking, if we don't produce enough naturopathic doctors, and also physician assistants, nurse practitioners, because there's been a change in the classification of what is a professional degree and the amount of financing, student loans that these individuals will be able to get, and other professions, I think chiropractors as well. We're going to have a serious healthcare dilemma here. We're going to have a shortage of having enough medical professionals helping patients. And we know that the number of sick people in this country, it's not decreasing, it's increasing. And so we should be producing more doctors, more health professionals. And I actually see it declining. Obviously, I don't have all the stats, but if we consistently see this pattern, that's going to be a real issue there. Now, I don't know if the systems are, if they're trying to create a shortage on purpose, but it's going to be a problem. It really is. And so what we're going to see is that people who don't have the resources definitely will be the first to be impacted to not have access to doctors. And people who have chronic conditions will struggle even more. So this would be a great time to start taking your health serious. And, and prayers and blessings to those, men and women, young or old, doctors or nurses or other medical staff that work in hospitals especially. I see them as patients. I have worked with nurses as my patients, and they're not healthy. They're not making healthy decisions because they're working these long hours, and usually it's very difficult for them to just sit down and eat. So I encourage them to take your breaks and have a snack and eat the right foods. Stop munching on popcorn and chips and energy drinks and soda, because that seems to be a very common thing to be eating in a hospital. How are you to take care of someone who's not healthy when your health is being jeopardized? So remember, physician, heal thyself. It's okay for you as a doctor to acknowledge your own needs. It's a must if you want to continue, especially to work in a high demanding, fast-paced environment with a lot of ill people. You want to take care of yourself. So I hope you've whether you're a physician or you work in medicine or you're a patient, just know that these things are happening. You might have noticed that your doctor closed their practice, or your OBGYN or some specialist you saw is stepping away from medicine. This is why. They're tired. They're sick and tired, and they want to live their life too. So until next time, I hope this message has brought you some new insight. And until next time, be blessed. Thank you for listening to Physician Heal Thyself, the podcast. If you like what you've heard, please like, share, and subscribe. Help this message reach more people who may need to hear it. Leave your comments. I want to know what you think. If you're interested in learning more about Raices, visit our website at raicesndmedcenter.com. Until next time, be blessed.